program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the Better Hair, Better You show with Dr. Sierra, where the Robotic Hair Institute in Fort Lauderdale, Florida is a premier robotic hair restoration clinic. Dr. Sierra treats men and women of all ages who long to return to the days when they had copious amounts of hair. From implants to toupees to various chemical applications, men and women are eager to embrace a variety of treatments that promise to restore hair to its youthful volume and abundance. This show will discuss the latest procedures and technology for hair restoration. We specialize in providing the latest no-scar, robotic view hair restoration surgery. And thanks to advances in medical science and technology, we also offer non-surgical procedures and medical protocols combined with proprietary topical compounds to help augment and solidify results. Get ready to call in at 888-565-1470 and join the conversation of this amazing procedure. Let's start improving our lives.
Happy Monday. Welcome back if you're joining us again. This is Better Hair, Better You. I'm your host for today, Alana Shearer, your South Florida arts advocate media host. And whether you're tuning in from 95.3, 96.9, 1470, or catching us on our live stream, we're glad to have you here. So without further ado, let me go ahead and bring on not just Dr. Sierra today, but a special guest as well. We have John, one of your clients that you've had, who will give us the full scoop and more details, I'm sure, to come. But for anyone new who might be listening and wondering what this show is about, let's give a little introduction to our one and only Dr. Rafael Sierra. He is the owner of the Sierra Robotic Hair Institute located in Fort Lauderdale, Florida. He specializes in, yes, robot surgery, essentially. But give our listeners a little bit more insight on what you specialize in and what it is that you do over at the Hair Institute.
Sure. Hi, Lynn.
Hi, good to see you again.
See you. So at the Institute, we specialize in hair transplant, and like you said, we do it with the latest technology, with the ARTIS robot system. And the technique that we use, or that we specialize in with the robot, it's called FUE, follicular unit extraction. And what we do is basically take one hair follicle at a time from the donor area and put it in the area that we want to achieve whatever the patient's goal is.
And I have my countdown going. It is officially 12 days until Christmas, right? It's the holiday season. The new year is right around the corner. I know I said it last show, but if you are looking for the best gift you could possibly give to either yourself or to someone you know that will boost your confidence, your self-image, and how you go about your everyday, this is a pretty unique and one-time gift, right? This isn't a reoccurring thing I would have to come do over and over again, because once I come see you, it's the better hair, better you, right?
Yes, that's right. And it's once somebody has a hair transplant, that hair that we transplant is going to stay there for life. It will grow and it will become, it's still your hair, just it will be better.
Perfect. Now, I have to ask, a question that had come in before from our last show is wondering if hormones and nutrient deficiencies are a contributor to hair loss. Is that true?
That is definitely true. As we mentioned before, especially for men, the hair loss that it's more prevalent, which is what we call the male pattern baldness. It's due to the action of DHT, dihydrotestosterone, that shrinks and eventually, we could say, kills the hair follicle, and that's what causes hair loss. Nutrient deficiencies also can contribute in a way to weaken the hair, and those are usually more easily addressed once are detected. We also offer IV therapy in the institute. If we detect anybody that has any of those deficiencies, we can also help them regain that healthy hair.
So that's cool. IV, say that one more time for me.
IV treatments.
An IV treatment.
IV, well, some people call it IV lounge, but it's basically IV treatments for any kind of deficiencies that somebody would have.
That's pretty cool too. I did not. I see you
It's a
learn
surprise.
something every week, right? Now, another question I had come in from before was Jay. He was wondering if, let me see over here. He is a type 1 diabetic and was wondering if receiving this hair transplant, if that is okay for him. What are certain factors that you look for when someone is asking for a consultation, or if this treatment is right for them?
So we definitely ask for any kind of medically we call it comorbidities or other diseases or problems that somebody could have that would put them at a risk of complications or not ideal outcomes. It's very seldom that I find somebody that is not a candidate because of these kind of problems, specifically with type 1 diabetes and also type 2. If the patient has their blood sugar under control, there is really no contraindication. And like we said before, it's a procedure, but it's considered minimally invasive, and the scalp has such good blood flow that complications such as infections and non-healing wounds is very, very rare.
So, Jay, we have good news for you. Dr. Sierra says, yes, it is good for you to go through if you are interested. So, if someone is interested, right, they want to start this process, what is the best way they can contact you or get some more information?
Well, there's two ways to contact us. One is to call us. The phone number is 954-776-0830, or you can just go into our website, sierrarobotic.com, and you fill a small form, and we can contact you right away.
Perfect. Now, I don't want to ignore our guest for the whole show. Let's bring him into the spotlight a little bit. Hello, John. Thank you for coming with Dr. Sierra today. How are you?
Great. It's my pleasure. Thank you.
Of course. So tell me a little bit more about your experience. When did you first meet Dr. Rafael Sierra or go into his doors for the first time?
Well, I'll give you a little bit of background. Okay, this is I'm suffering, or I had suffered from what Dr. Sierra discussed as androgenic alopecia, right? You just, men over time they suffer from male pattern baldness.
Baldness.
Due to, hormones, testosterone, whatever. It's it can reduce your hair follicle count, but it was such an insidious thing because it happens slowly over time. I didn't notice it overnight, but I at some point I'd always ask my wife, I'm doing all right. Right? Everything's
you give the check-in once in a while, like, I'm good, right? I'm good.
Yeah, everything's great. You're looking great. But one day, I said, I'm not so sure. And I took a picture of the top of my head with my iPhone.
Yep.
And that was like heartbreaking, So I had kind of been doing everything along the way, the minoxidil and even playing with the, micro needling just to kind of keep things going. And when I saw this picture, I said, I got to do something about this. So I started researching online, hair transplant. And I'd come across a number of different providers, made some calls, and the one man that stuck out, was Dr. Sierra, because I wasn't speaking directly to a salesperson who was pushing. It was just very informative, like black and white, right to the point. Gave me the facts about follicular unit extraction versus strip method, and had a very good consult. Took the time to explain the whole process and procedure, and I was sold at that point. Like I felt like I was in good hands, and it was a great experience. And I'm a few months into this after, so it just every couple of weeks I notice more.
Do you ever so often take your iPhone picture for updates to try and check in and see the growth?
I have done it. I have, and it's quite a contrast. It's quite a bit different. I'm very happy, and I can say this is why I'm here. Is really it's been very transformative. sort of life changing.
Well, those are the words we like to hear. I mean, we talk about it almost every week about how we can only imagine the confidence it would give to people and that comfort around family, friends, the workplace, to be able to have that confidence when you walk back in and to hear it firsthand about how it's affected you and how you're happy and with its success. I mean, congrats. And to hear that even within the first, you said about 5 months or so now.
That's right.
It's been in. That's really.
Yeah, and then what I
great
was
to
telling
hear.
John is this is just the beginning. This is probably about 50% of what the final result will be. So we'll see the final result in another 5-6 months.
Yeah, it's nice to, to meet up with friends or acquaintances that I haven't seen in
Some time.
a few months or a year, and they say, "Oh, you're looking great. What is it? I can't put my finger on it." You've been working out? Well, maybe a little bit, but it's nice that it happens sort of gradually.
Gradually,
too,
yeah.
But yeah, it's put me on a completely different trajectory, I think, and I'm quite pleased.
Now, something else that we usually talk about on the show, and we get a lot of questions sometimes from viewers, and they're wondering all different things. A lot of the time, we're trying to connect with people to understand that this is your actual hair that is growing back. It doesn't feel synthetic. It doesn't feel fake. Do you feel that it blends in with the rest of your head of hair and everything looks natural and great?
I certainly do. In fact, I would say in my particular case, I'm a little bit better, because the donor area in which the hair was extracted is thicker. It's just the hair shafts were a little thicker than what was on the top of my head, and so I've, in addition to the increase in hair count, there's been a bit of an increase in the thickness of the hair as well. So, yes, but maybe more so than what you might think.
Better than expected.
Yeah.
Which is pretty cool to hear.
Yeah.
Before we cut to a commercial break, maybe let's talk a little bit of that process of where you take the hair from to do the process, because that's unique in itself too, that you're doing the most accurate, the less invasive type of
Correct.
procedure for this.
Yeah.
Can you explain a little bit more about how this is done?
Sure. So what we call the donor area is the back of the head and up to more or less the middle ear area on the sides of the head. And the reason why we choose that part of the head is just in males, because there is data that shows that those hair follicles are not sensitive to the hormone, the DHT, and therefore when we move them, we can move them anywhere in the body and they will grow regardless, or as long as they get some blood supply, then they will grow. So they are, like John said, the quality of the hair that comes from those follicles is it's better just because of that. And so what we do is we remove each one of those hair follicles using the robot. We are making sure that we get the best quality of those hair follicles, and those follicles will survive the process of transplantation.
Which is pretty fantastic to hear. Science and technology today is unbelievable about what it can do and how far we've come. So to see the results firsthand is pretty spectacular. We will be right back, but for now, we're going to cut to a commercial break. This is Better Hair, Better You. Stay tuned.
At Sierra Robotic Hair Institute, most patients notice incredible hair growth within a few months after their procedure. New hair growth may continue over the course of a year, with the most noticeable results usually seen 12 months after the procedure has been performed. The new hair growth can provide patients with natural, thicker hair and fuller results. Men and women who undergo our post-surgical hair restoration protocols often experience dramatic and significant improvement in hair density and volume that helps augment procedure results. Sierra Robotic Hair Institute has performed numerous hair restoration procedures, all with excellent success. If you have an interest in the latest, next-generation hair restoration and would like to learn more, please give us a call at 954-776-0830. Again, that's 954 776 0830.
Hi, and welcome back to Better Hair, Better You. I'm your host for today, Alana Shearer, joined with Dr. Rafael Sierra of the Sierra Robotic Hair Institute and the beautiful hair model, John, we have with us today. Thank you guys for being here. Now, I have to say, for anyone wondering where he is located, the Sierra Robotic Hair Institute is on 2151 East Commercial Boulevard in Suite 204, located in Fort Lauderdale, Florida. So whether you are in the South Florida area or from far away, you can make it happen and take the trip down. We've talked about in previous episodes. But let's get back to talking with who we have in with us today. John, we were just talking over commercial about where exactly your hair transplant took place and how long it took for your situation, because it can vary sometimes, but usually it's one long day. So I wanted to ask the both of you,
Right.
in John's case, how long did it take and where did we do the hair transplantation?
You want to go ahead?
Yeah, sure. In my case, it was a long day. It was about 12 hours from start to finish, and I'm assuming that's because there was a lot that was done, but a lot of that time was spent prior to the procedure, just kind of easing my nerves,
Yeah.
and calming me down. It's a first for me, and it's a bit of a it's I've never had a surgery before, so it's just you got a little nervous.
It is a serious thing. I mean,
Yeah.
we talk about it very casually all the time, but at the end of the day, it is a surgery.
It's surgery, and that's one of the things that I try to do because with my experience, I know that for me it's my job. I do it all the time, but for the person on the other side, it's a in a lifetime experience most of the time, and it's not easy. I mean,
It's a pretty big deal.
Yeah.
It's a big deal, but having gone through it, it was a very pleasant experience because what Dr. Rafael Sierra and his staff, have done, and the sort of protocol that they have in place is really about comfort. So to say that hair transplant was a pleasant experience, it's probably not something you hear quite often.
Not
but,
what you would expect.
right? But did a fantastic job of just not just calming, easing, but creating an environment that's really quite pleasant, throughout the whole process. There's I don't know if we want to go into it as much, or if you'd like to talk about it, but there's no pain. There's no pain for good reason. I mean, you're set up with what is it? What is the
local anesthetic.
the local anesthetic,
Yeah.
and that eliminated everything, and then just the time just went by so quickly because the interaction, the back and forth, the conversation throughout it was just it was nice. It wasn't had nothing to worry about.
And this is something that you are awake during the process. It's not like you are completely under while doing
No.
this procedure,
We
correct?
do offer nitrous oxide, which is a light anesthetic. People do it, and then you kind of go into a state of relaxation, but you never go completely under anesthesia as far as having something intravenously or something like that.
So did you say you were able to have conversation throughout the 12
Yeah.
hours?
Yeah, I had a good time. It was a nice time. I would want to schedule a second follow up. Just maybe do some more, because it was just it was pleasant. That's all I can say. It was just a nice, relaxing, pleasant experience.
Well, that is good to hear that you are in a safe space when entering the doors of the Robotic Hair Institute, and that you are in good hands and good conversation too. Who would have known, right? Now, you did mention before that you are very happy that it is a gradual noticing. You said family and close friends who maybe see you more often, could they notice right away, or it was one of those things where they couldn't quite place their finger on it?
could not notice right away. And I don't know the science behind this. I've read up a little bit of it, and Dr. Sierra is certainly qualified to talk about it. But from my understanding, from a layperson, once the follicles are transplanted, they go into the dormant phase.
Yes.
So they don't just start growing right away. It sort of presses reset on the
Yeah, exactly. That's pretty much.
So you have to wait until
It truly grows in.
Yeah, exactly. But that process, that gradual process, is I'd say started noticing results. I'm my own worst critic, I guess, and examine very closely. I could start seeing things, little new growths, a couple months later. But around when people would actually comment was 3-4 months, and it's I see it more now than before.
Does he have to go back in to have any procedures done?
So patients don't have to come back to have any procedures. We do offer PRP, which is platelet-rich plasma, that in a way boosts the growth of the hair. And if people are interested, it can also be applied for to decrease the amount of hair loss or slow down the process of losing hair. So down the line, 10 years from now, you might not need a transplant.
So it's to keep your hair healthy.
Yes.
And you said it was a plasma or platelet?
Platelet-rich plasma, PRP, and it's being used for many things. Specifically for hair, we inject. It's a concentrate of your own blood. We take about 60 cc's. We spin it in a centrifuge. We get a concentrate about 8 cc's, and that concentrate has molecules that are called growth factors, and that restores tissue. And that has been shown in some studies that it does improve the health of the hair. So with the transplant, we offer a free treatment and lifelong 50% discount if people are interested.
Which is good to know. Now, if someone was not yet on the verge of receiving or wanting a hair transplant yet, could they also receive the PRP before
Yes.
a hair transplant
Yes,
if they wanted
definitely.
to come in?
Mm-hmm, definitely.
So good to know. So no matter where you are in your hair care stage of life, you can come in to Dr. Rafael Sierra, and he will help consult you to the best of his abilities. It is truly a one-on-one experience, correct? Did you feel that when you had your initial consultation or phone call or conversation that it was a direct case-to-case about what was best for your situation?
100%. Yeah, and it's one of those unexpected, pleasant surprises that the communication afterward has continued. The follow-up care. We live in a society now where it's like one and done. Mill type of practices, but to actually, get follow-up from Dr. Sierra and wanting to see the progress has been nice, and that's kind of why I said I'd like to be an evangelist for your service, because I think it's special. It's made a difference in my life, and I certainly do appreciate the aftercare consults as well.
Well, I wish you the best in the months to come, because we are not even to the full viewing of what your hair can look like yet, but it looks fantastic. Thank you so
Thank
much
you.
for coming in and for speaking on Dr. Rafael Sierra's behalf and your experience and how you felt it has changed your life. Dr. Rafael, would you like to go ahead and give your website and phone number for if anyone is interested one more time?
Sure. The phone number is 954-776-0830, and the website is sierrarobotic.com.
Perfect. Well, thank you both so much for being on today. Again, Sierra Robotic Hair Institute in Fort Lauderdale, Florida. We will catch you next Monday for another show. You've been watching Better Hair, Better You. I'm Alana Shearer, and have a good night.
You have been listening to the Better Hair, Better You show with Dr. Sierra. Dr. Sierra has shared valuable inspiration and information to help restore hair growth and confidence. If you want more information, call Dr. Sierra at 954-776-0830 or visit his website at sierrarobotic.com. And tune in again next week for another valuable life improvement moment.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.